Gynecologic Cancers. Welcome. My name is Erica Narducci. I'm the program director at Cancer Support Community Delaware. We're going to continue to have people joining us as we get going, so you might hear some dings and such. This is a presentation provided to us by our national organization. We are a local affiliate of a national organization, and the mission of Cancer Support Community and Gilda's Clubs is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. And we, like I said, are a local network partner or affiliate in Delaware. We are located in all 3 counties of Delaware. We offer no cost in-person, hybrid, and virtual programs for cancer patients, caregivers, and loved ones. And we do that by doing support groups, we do healthy lifestyle classes, and then we do great programs like this for educational sessions. This program today was made possible by a generous support of Pfizer and Merck, and also Novacure and GSK. So thanks to them. And I'm going to turn it over to our speaker. Actually, before I turn it over to them, I just want to say, remember, we are recording. You are, because you signed up today, you'll get the recording. You'll get any of the resources mentioned today, the slide deck that we're showing. So you can watch it again and remind yourself of anything you heard. If you have questions during the program, feel free to put it in the chat. We're also going to have a time for Q&A at the very end. And if there's questions during the presentation, I can kind of break in if there's anything relevant in the chat. Otherwise, we'll save it to the end. So feel free to do that, and we'll have time to unmute yourself and talk at the end with questions. So without any further ado, I'm going to turn it over to Dr. Shaw and Dr. Frost from Medical Oncology Hematology Consultants. It's all yours. Just tell me when to advance the slides.
Well, good afternoon to everyone. My name is Dr. Palak Shah. I'm one of the medical oncologists here at Medical Oncology Hematology Consultants. And I want to also introduce,
Hi, everyone. I'm Dr. Frost. I'm a clinical health psychologist. I also work in the same office as Dr. Shah. And we are just excited to be here to spend some time with you guys today.
I apologize. My slides are going crazy there.
Oh, no worries.
That's okay. Basically, the next 2 slides just let you all know that we don't have anything to really disclose in terms of conflicts of interest. These slides were created by Dr. Laura Chambers, and so we are utilizing them and providing really a lot of information from our own experience and expertise. And so we welcome any questions that might come up as we go through any of the topics for today.
Yeah. So I think we just kind of want to go through the agenda. The main thing about today's talk is that we want you to walk away with, feeling more empowered, more knowledgeable about this kind of overall topic of gynecologic cancers. We want to understand different treatment options, preparing for medical visits, knowing what are second opinions, what are clinical trials, and also understanding common challenges, emotions that kind of also are part of this whole journey, and also want to be able to, have information for how to care for the caregivers and also just other support for resources. So first we'll start with the overview of gynecologic cancers and understanding treatment options. So I know, when you enter any doctor's office, there's so many terms and new unknown words that are always kind of thrown around. So we want to kind of break down a few different ones, especially in this realm. So gynecologic oncology is a field of medicine that focuses on treatments of cancers of the female reproductive system. So these are ovaries, vagina, uterus, cervix, vulva. And then a gynecological oncologist is a doctor that specializes in treating these type of cancers. You may hear words such as genetic testing or biomarker tumor testing. So genetic testing is usually testing the blood or saliva, and that's looking at your specific DNA. This is to look to see if you have inherited a mutation or a switch or change in your gene that may have increase your risk for ovarian cancer, any other types. And then biomarker tumor testing is a little bit different. This is actually looking at the tumor itself, and it's looking at the cells to see if there are any specific mutations in the tumor. And sometimes this may open up our kind of toolbox for different treatment options. So when we hear the big word gynecologic cancers, as I mentioned, these are types of cancers that are in the reproductive organs, and they start in these organs of someone who's assigned as a female at birth. There are typically 6 main types, where ovarian, cervical, uterine, vaginal, vulvar, or gestational trophoblastic neoplasia are kind of more commonly seen. And the 7th type, which is the fallopian tube cancer, those are a little bit more rare. So there are a few risk factors that do put patients at risk for some of these gynecologic cancers. One would be having endometriosis. Another is not having a child until age of 35, or not being able to have a child, or never having a child. Another few is having family history of certain cancers, such as ovarian or colon, uterine, GI tract cancers, or urogenital cancers. And then there are also some hereditary cancer syndromes. So that is some of those mutations that could be passed along through your family, that could increase your risk if you have BRCA1, BRCA2, Lynch syndrome, or Cowden syndrome. So first, looking at ovarian cancer. So, these are cancers that begin in the ovaries. Our ovaries, we have 2 ovaries in our reproductive system, and they're about, the size of a walnut. There are 3 parts to the ovaries. The first is this epithelium that covers the surface of the ovaries and protect it. There are also these germ cells, and those cells are the ones that produce the egg and release it every month. And then we also have sex cord stromal cells, and those produce the sex hormones. Now, based on where the cancer starts to grow, that kind of subtypes the different, we look at the different types of ovarian cancer. The more common one is the epithelial ovarian cancer. And that's when the cancer starts in those epithelium cells. Another part of our body near near the ovaries and the fallopian tube is called the peritoneum. So you may hear that word too. The peritoneum, I like to think about it as like kind of a sheet covering our belly. And this is lining all our organs that are in our abdomen and our pelvis, or in our belly region. So sometimes there could be cancers that arise from that area, then that's called peritoneal cancer, or also cancers that are from the fallopian tube. And a lot of times these different types of cancer are also treated very similar to ovarian cancer. Next, as mentioned before, fallopian tube cancer. Now, this is a rare type, and a lot of times it's linked to having advanced ovarian cancer, and is treated very similarly to ovarian cancer. The fallopian tube is kind of the passageway that connects the ovaries into the uterus. We also have cervical cancer. So this is when a cancer arises from our cervix. So that's the lower part of the uterus that connects to the vagina. These are usually very slow growing cancers. Now, you may have heard, when you go to your gynecological doctor about being vaccinated for HPV, or even as a kid. So a lot of cervical cancers can be found early with regular preventative screenings, and can be prevented with the HPV vaccine. And that's because about 95% of cervical cancers are caused by the HPV, or the human papilloma virus. So that's why it's important for vaccinations. And about half of all cervical cancer cases occur in women between ages 35 and 55. And if it's caught early, it can be curative many times there. The next is uterine cancer. So this is cancer that forms in the in the inside of our uterus. And endometrial cancer is a type of uterine cancer, and sometimes you hear that word also being used. And this is one of the most common causes of cancers in American women. Now, most endometrial cancers start in cells that make mucus and other fluids in our uterus. Uterine cancer can also start in the cells that make up the wall of our uterus. And these are cells like our muscle cells or myometrial cells. This is a little bit less common. So usually when people say uterine cancer, they're typically talking about the subtype endometrial cancer. Next, vaginal cancer. So this type of cancer is not as common as, let's say, uterine cancer or cervical cancer. Many vaginal cancers are also caused by the similar virus, human papilloma virus. And again, when it's found in its early stage, it can be cured. There are two main types of vaginal cancer, and this is again based on what type of cells are causing the cancer growth. So there could be squamous cell carcinoma, and these are thin, flat cells that line the vaginal area, and this cancer spreads pretty slowly, stays typically near the vaginal area over there. And this type of cancer is commonly found in women over the age of 60. Another type of vaginal cancer is called adenocarcinoma, and this is cancer that begins in the glandular, these secretory cells. These are the cells that kind of release a lot of fluid, such as mucus. This is a type of cancer that's usually found in younger females, about 30 or younger. And then another type is a vulvar cancer. So this impacts the labia majora, labia minora, and can affect any of those external organs. This is again a very rare cancer. It's about 0.6% of cancers in all women. And it's very slow growing. And again, this also has different subtypes. The more common type is squamous cell carcinoma, but we also see adenocarcinoma, Paget's disease, sarcoma, and basal cell carcinoma. Now, before I go on this slide, I did mention a lot of different subtypes of cancers. The important it sometimes seems a little nuanced in terms of the different terminology, but a lot of times it's very helpful for the doctor because that could change your overall treatment plan, or it can also give some more information about prognosis. So I wanted to move in a little bit about looking at the signs and symptoms. So these are some kind of symptoms that may also feel to be non-specific that sometimes do appear with some of these gynecological cancers. So fatigue, unusual bloating, trouble eating or feeling full quickly. There may or may not be some pain in the belly, pelvic area. May see frequent urination, changes in bowel movements. And a lot of these symptoms are because where our reproductive system is, we do have a lot of other organs in that area that may get affected, such as our bladder and our bowel. You could experience bleeding or discharge that's not related to menstruation, any pelvic pain, pain during sex. And then there could be some physical changes that at times could be a sign for vaginal or vulvar cancer, such as a lump in the vaginal area, constant itching, changes in color or the way the vulva looks, an open sore that lasts over a month, or sometimes if the skin of the vulva looks white or feels kind of rough. And so when first a diagnosis is made for any of these types of cancers, there's always usually a protocol about staging to know where, more imaging to know what is the size of this, where has it spread or not spread to, that can help determine the size of the tumor and the stage. Based on the stage, it kind of helps the kind of medical team to figure out an overall treatment plan. And so based on the type of cancer, the stage of cancer, these are potentially some of the treatment options that you may hear of. So I think it's very important to know a little bit about, okay, what does it mean when someone says immunotherapy? What does it mean when someone says radiation? So I wanted to kind of go through that. So one of the kind of main treatment options for a lot of these gynecological cancers is surgery, especially like ovarian cancer or uterine cancer. So during surgery, a gynecologic oncologist will remove as much of the cancer as possible. So this is called debulking. So you may hear that word being used. And now sometimes before or after surgery, based again on the size, the type of cancer you have, chemotherapy may also be utilized. So chemotherapy, or as you know, chemo, these are drugs that are basically attacking rapidly dividing cells. So our cancer cells are part of our cells that are really, really fast growing. So they are attacking and destroying those cells. Now we use chemo to help shrink the tumor, slow the cancer's growth. We want it to not spread to other places, not cause any symptoms, and really help patients live longer. There are different types of chemos. I think traditionally we always think about the intravenously or someone having an IV, but now there are also some chemotherapies that are given as a pill, orally, or even as injection. Another type of treatment would be targeted treatment. So similar to chemo, but targeted therapies are drugs that are really targeting a very specific change in the cancer cells. So that's why, as we mentioned before, the biomarker tumor tissue testing sometimes can be very helpful, because you can pick up specific mutations that are in that tumor itself, and we may have a targeted therapy for that. So this is kind of looking straight to that target, attacking that, and so that we can kind of pause or stop that cancer cell from growing, dividing, and spreading. So it's a little bit more precise in some sense. And at times, this might be only fighting the cancer cells and not harming other parts of our body. Another treatment option is radiation, which is also very commonly used. Radiation therapy treats cancer by using radioactive energy. It's kind of like an X-ray, but a more powerful X-ray. And that is to help destroy the cancer cells and stop them from growing. The other kind of more commonly in the last few years you hear about is immunotherapy. Immunotherapy is, I would say, pretty cool and exciting, a different way at kind of approaching cancer care. So a lot of times immunotherapy will be used with chemotherapy. And what this is doing, it's basically telling our immune system that, hey, we need to go fight that cancer cell. It kind of is very much boosting it so that the immune system kind of can find the cancer, attack it, and kill it. And these are typically also kind of through IV. So that is sometimes also simultaneously used. And then the other thing we'll talk a little bit more also in detail is about clinical trials. So clinical trials are research studies that are comparing what right now is the most effective known treatment for a specific type or stage of cancer with the new approach. And this new drug or combination of drugs is really to help improve our field and really get the best treatment out there for all patients. All right, so the next part we'll talk is a little bit more preparing for visits, second opinions, clinical trials.
Okay. So I'll talk a little bit about from kind of my standpoint and how I typically work with folks around how can we best prepare for the appointments that you'll have. And then Dr. Shaw, if you want kind of from the medical side, what you find to be helpful in navigating those visits. So we'll kind of break it up into two different parts.
Yeah.
But I like to really think of appointments as helpful scheduled times for you to meet with your medical team. And it's really a time for a collaborative approach to reviewing and addressing a ton of different factors throughout your cancer journey. And so I think to maximize that appointment, preparing in advance can be really helpful, coming with some questions and really ensuring that that list of questions is in order of priority so that the most important questions can really be answered first. And while we want to make sure that all of those questions are answered to the best of everybody's ability, we also want to make sure that the visit is as focused as possible, because sometimes just too much information can be overwhelming. So I think that's why that priority can really be useful. It's also, I think, a really good idea and can be really helpful if you're able to bring somebody with you to the appointments. And I always think an extra set of eyes, extra set of ears, right? There's so much information that's being shared that it's very easy for things to get missed or forgotten. And so having that support person there, taking notes, just listening can be a great way to make sure that all of that information is captured and perhaps, if it's written down, housed somewhere that you can always reference back to at a later time. The last thing that I think can be really helpful is if you don't understand something that's being discussed during the visit, please ask for clarification or for a different explanation. There's so many new terminologies, so much different language that we're just not used to experiencing every day. And we want to make sure that you feel as confident as possible in understanding what is going on and what your treatment plan is. So I can definitely speak for our office, but we always welcome questions and feedback if you feel like more information is needed. And I think the purpose of these things can be that this is often a time where so much feels that like it's out of our control. And so having some of these things in place can help you feel like you've regained some of that control and can maintain some of the control throughout the process. I think keeping lines of communication open and approaching the visits as an opportunity to join with your team to tackle the problem together can feel a lot more supportive rather than feeling kind of that sense of loneliness. If there's any caregivers that are on the call, I love having caregivers be a part of visits. It's important, I think, to be included as much as the patient, as your loved one wants you to be included, and as much as you're able or willing to be included. Really, I think the caregiver's role during a visit is different than the patient's, and being present for support, supplementation, remembering what the patient said last week that they wanted to ask about, taking notes, being a helpful advocate if that's what the patient needs, and processing the visit afterwards can be such a lovely way to participate. Dr. Shaw, I don't know if you want to add anything.
Yeah, no, I totally agree with Dr. Frost there. I would, definitely want to highlight what she mentioned about coming in with a list of questions, and also bringing someone with you. I think that's always very, very helpful. These discussions, especially in the beginning, can be a lot. It's an information overload. There's new terms being used, this is a cancer, the C word, always, it's a very frightening one. So there's a lot of emotions, a lot of it kind of thought process going on. So it's very helpful and nice to have another set of ears and eyes there. I always, tell my patients, what do you want to know? And I think it's also important if you tell your doctor, your physician that, these are some of the questions, this is what I want to know about, what are treatment options, asking your doctor about what is the stage. You can ask, or you don't need to ask about prognosis, but that is a question that, a lot of times comes back in patients' minds. And then also asking about, okay, what are side effects and what should I be expecting? I think it's always helpful when family and friends are there to kind of also help give, to know, okay, when my patient goes home, there is someone to help them out. Because it's a long journey in a lot of these cases. So it's very important to have great social support. So I think it's always beneficial to have someone there.
So I think another really important thing to highlight is that through this process, it can very easily feel like you're getting lost for who you are as a person. And so I really encourage folks to talk with their healthcare team about what is most important to you. Specifically, what are your goals? What are your values? And it really helps not only build, I think, a trusting relationship with your medical team, but it can help you guys have a deeper, more meaningful discussion around developing an approach to treatment that balances your treatment goals, but also quality of life. If you're not sure what your goals and your values are, if you're sitting here and you're like, I don't even know what you mean. Where would I even start with thinking about that? I think this slide provides some really good prompts that can lead you to some of those answers, and in different, I think, areas of your life. Right. So for example, do you want to continue working if you're working? If you're not working, are there activities that are very important to you that you want to still be able to engage in? And I think whatever answers you have to those questions are really great things to share with your medical team. Because if it starts to get to a point where you're not able to engage in those things for whatever reason, we can always figure out a way to either modify or address any barriers that might be getting in the way. And your goals can change over time. This isn't a conversation that maybe you just have once or twice, but it's an ongoing, evolving conversation. What is most important to you may shift depending on a lot of different factors, and that's okay. That's very normal. That's expected. And we're always willing to figure out how can we adjust things and provide support to make sure you're able to do the things that matter most to you. We can go to the next one.
I have to apologize. This was a video and I'm unable to access it because of my firewall. So maybe you could just talk a little bit about the importance of a second opinion.
Yeah, no, definitely. So I think it's always, important, and it's always okay to ask for a second opinion. I always tell my patients that you are your own best advocate. And if you feel like, I just want to maybe double check or make sure that, okay, is this the right treatment plan? Are we not missing anything else? It's okay to let your physician know that, hey, I also just want to get a second opinion. And, I personally am happy to be like, that's totally fine. I think you should try to make sure you're comfortable with the treatment plan going ahead. And I think that's what the video was also just highlighting is, if you feel any doubts or anything, ask for a second opinion. Because again, as I mentioned, this is a journey that you'll be on. And so it is very much okay to ask for another set of eyes to look at the case. Most of these, or mostly all cancer patient cases, we do have like a tumor board where we discuss with other doctors, with like radiation doctors, surgeons and stuff. But it's always very important to get a second opinion if that's what you'd want. And then the next thing is about clinical trials. So, clinical trials, as mentioned before, these are testing for tomorrow's treatment. We're always trying to improve what we have right now so that we have the best options for treatment out there with less side effects if possible and better outcomes. And so one thing to ask about your oncology team is what are some of the clinical trials that could be available and how could they benefit me? Clinical trials, typically they use a system of randomization, but not all trials have the same type of randomization. And the importance of randomizing the patients in the trial is to really eliminate any biases. And so it's important to know that you're not treated any differently by a research team based on the treatment you receive. And typically, the research team doesn't even know which group you're assigned to. And it's important to ask your team about which phase of a trial is this? How is this going to improve my outcomes? Am I eligible for a clinical trial? How do I get more information? There's typically a team of research nurses who can give more information to know, okay, is this something that I would like to participate in?
Okay. So now we'll talk a little bit more about some common challenges that folks experience throughout their cancer journey. Talk about how we also provide care to caregivers and how to find some support. So some common challenges that we often hear is that I feel like I don't have any control, or I feel like I've lost control in my life. And as you grapple with such a significant challenge like a cancer diagnosis, something that you didn't ask for, you do not want, it's important to acknowledge that these feelings are real, they're understandable, right? They're very human reaction to such a significant experience. And that despite the feeling that you don't have any control, there are still aspects of your life that you do have control over, right? Our mind is kind of tricking us into feeling that we don't have control. And so I find that writing down a list of things that you do have control over, things like attending your medical visits, moving your body in ways that feels good, eating foods that nourish not only the body, but also the soul. I'm a big fan of recognizing that food is not just always for specific nourishment. Um, Spending time with friends and family, doing things that bring you joy or peace, right? Having those things written down can be a helpful reminder when that feeling of lack of control starts to get loud. There can also be feelings of unwanted loneliness. And this may resonate with some of the folks on this call, but so often we can end up feeling like nobody understands what we're going through. And that can leave us feeling really lonely. And even though it's true, there probably are people in your life who are not going to understand for a variety of reasons. My hope is that either through discussion with your team or even participating in this call, that we're able to kind of show you areas that there are people that understand and can provide that support. And then a last common challenge is living with uncertainty. And anxiety and fear for the future and the unknown is common at a lot of different points throughout a cancer journey. And as humans, we generally don't like the unknown and we don't like uncertainty, but it's always been a part of our life. Unfortunately, cancer just kind of puts that right in our face. And again, that doesn't feel very good. So part of my work is helping folks learn to accept uncertainty as a part of life, even though that's really hard and it takes constant work. I think reminding yourself that we can never know what the future holds, but we can know what the present moment holds, and focusing our energy and our resources on that, turning our mind towards things that bring us joy and peace, can help us stay grounded and help us really navigate a cancer diagnosis. So life after the diagnosis, it's really a pivot point in our lives. And so life afterwards can look a little bit different than it did before. Some of these changes may be ones that you chose, right? Changes to your diet, perhaps, changes to how you spent your time, different or new sources of support. And some of these changes might be things that you didn't choose. Things like changes to how your body looks or functions, changes to your usual routine. So you may want to put the experience behind you and kind of have life return to the way that it used to be, but this might not always be possible. You may also wish that you could have a fresh start at something new. And one of the hardest things after treatment is not always knowing what's going to happen next. So those who have gone through cancer treatment describe really those first few months as a time of change, not so much as a getting back to normal, but as kind of figuring out what is my new normal? What does life look like now? And that can include things like managing ongoing side effects, developing kind of a survivorship care plan with your team, and attending to your emotional well-being and your physical well-being.
So I want to go over some side effects. So it's really important that before you start any treatment, that you know what to expect. Now, not all of these symptoms will occur to every patient, but it's just good to know and what may happen and how I can manage, or how you can manage your quality of life during and after treatment. And a lot of times, these treatment side effects are because of the way the medications work. So very common side effects that you have heard of is hair loss or hair thinning, nausea, vomiting, diarrhea, constipation, mouth sores. And then sometimes they're specific to the specific treatments such as nerve pain or neuropathy or swelling of your legs. I always tell my patient that fatigue will come and go. Some days may be better than other days, and to really listen to your body. It's important to be active, but it's also important to, if you need rest, you take some rest. You may notice changes in your physical appearance. Your bowel and bladder patterns may also change. Patients may go through early menopause. There may be difficulty with sex, intimacy, and fertility. And then there could also be anxiety and depression. So these are, side effects that are potentially possible. And it's very important to keep them in mind and know what are strategies to mitigate these side effects. And, along with that, sometimes there's long-term side effects and late side effects. Sometimes there could be even months later, they'll be looking at your heart or your lungs, making sure there's no late side effects from that. Bone loss, sometimes changes to your vision and your hearing. And management of these side effects include many of the practitioners that we mentioned before. There could be new specialists like seeing a cardiologist or a lung doctor that may help with focusing on those side effects afterwards. You may need to see a physical therapist to help regain your strength. Sorry, Dr. Frost, were you saying something? Okay. And so, as I mentioned before, there are specific side effects with the cancer treatment. Cardiotoxicity, or basically toxicity that affects your heart, it is common with some of the chemotherapies and maybe even some of the radiation. So it's important to talk to your care team if this is a side effect. If you're experiencing swelling in your legs, chest pain, shortness of breath, anything like that, and you may need to see heart doctor. It may require further testing, such as an ultrasound of your heart or MRIs. Some of the cancer drugs and the stress of cancer itself can lead to cognitive changes. You may have heard of something called chemo brain. So there may be times where you've noticed that you're thinking a little bit slower, or maybe other folks around you have paid attention to some changes. So ask your loved ones, have they noticed you forgetting things or any changes there, and talk to your care team about those if those symptoms come about. Neuropathy is also common. So neuropathy is sometimes pins and needles in your feet, in your hand. It could be numbness, weakness. And this is a lot of times nerve damage that can happen. And a lot of times, we look out for that because we don't want falls to happen or not knowing about a sore on your foot. So if you're noticing any of those neuropathy symptoms, also important to talk to your team. And then the other thing is about physical therapy. Now, cancer in our reproductive system and then radiation treatment, surgery can affect a lot of our, bowel, bladder, our sexual functions. There are physical therapists who specialize in pelvic therapy, and they can provide a private space, safe space to discuss these intimate issues, and also work on helping to strengthen those pelvic muscles. And that may help because at times there could be urinary incontinence, and it's important to regain urinary functions. Sometimes some cancer survivors may experience fecal incontinence or sexual dysfunction or pain after treatment. And at times physical therapy can help with strength of muscles and regaining your control and confidence. And then another thing is, of course, our physical wellness in terms of our diet and exercise. I think those are definitely important questions that I get a lot from my patients about what can I do with my diet? Do I need to make any changes? I always say, you want to have a good, healthy diet that's pretty well-rounded. A healthy diet means limiting sugars, processed food, limiting alcohol, and eating more whole foods, more veggies, more fruits, whole grains, and try to reduce that processed kind of food. There's no really specific diet that is like the best diet for when you have cancer, but it's really just eating a nutritional meals that will help give you that strength to kind of get through treatment. And then the other thing is there's always nutritionists, dietitianists who are available if you have any other questions or want any specific recommendations. And the other thing that's very important is movement and exercise. Going through cancer treatment, some days you may not feel much to move around, but it's very important to try to keep yourself active as much as possible. And it's okay to rest, but if you're able to move around, walk, do some exercise, if that's even light, like yoga or something that is building some of that strength. There are studies that have shown that people who move, who are a little bit more active, they do better with their treatments overall.
Okay. So your body goes through so much during treatment. And according to research, over 40% of people do have feelings about how their body looks post-treatment. Surgery, systemic therapies like your chemotherapy, radiation can all change how our body looks, but also how we view our body, how our body functions. And all of that can certainly lead us to feeling sad, embarrassed, perhaps, and impact our self-esteem. It can also make things like intimacy more challenging. So how do we cope with these changes to our body? I think first and foremost, it's okay to grieve any losses or changes. It's okay to feel sad and angry and frustrated. Those feelings are real, right? Give yourself the time and space to feel those feelings and to grieve. It's also okay to say, hey, let me see if I can figure out new ways to love my body the way that it is now. And I think talking with close friends, talking with mental health professionals can help you navigate something that is going to be easy some days and hard other days. Building connections within your community, talking with other survivors can also help provide solace, figuring out how do you guys navigate some of these changes? What's worked for you? What's been helpful? Can be a way to start to fill in some of those new challenges that might be arising. Next slide, please. In addition to that, right, so our body might not look the same, it might not feel the same, it's functioning differently than before. And so you might be experiencing things like early menopause, worsening or renewed menopausal symptoms, or just changes to your menstrual cycle. And as a result, kind of physical and emotional intimacy can change. It can be difficult to navigate, not just for you, but also potentially for your partner. I think trust and communication, and sometimes the inclusion of additional care specialists can be important ways to support this aspect of your life. Sexual health is a part of our quality of life. Talk to your care team about things like medications that could be affecting your sexual health. Let them know if you're experiencing things like pain or discomfort during sex or intimacy. Your care team might also have advice for how to manage some of those physical side effects. You can also ask if you can be referred to like the pelvic floor therapist, like Dr. Shaw had mentioned, or perhaps a sex therapist. Couples counseling in the community could be a really good option to help figure out how do we navigate sexual health at this point. I think similar conversations with partners are really important too, making sure that they understand some of the changes that might have come about because of treatment and figuring out how to help them manage navigating that and being supportive and keeping those lines of communication open can be really beneficial. The overarching first step to navigating intimacy during and after treatment really is patience and understanding, allowing time for folks to mourn any losses that they've had, preparing themselves if they want to become intimate again, finding confidence in their bodies, and communicating when they are ready. Understanding the difficulty is experienced both by the cancer patient and their partners, and helping them build trust is something that we as providers are very happy to facilitate.
And some cancer treatments, radiation, chemo, or surgery can affect a person's ability to have children. So if you're thinking of having children, let your doctor know as soon as possible. There are options such as tissue freezing or egg banking that can be started before treatment starts. And before you begin any of these procedures, you want important to check with your insurance company to make sure that they would cover it. If banking or tissue freezing is not an option, then you may want to talk to your healthcare team about alternatives, such as adoption, surrogacy, or a donor.
So it's normal to experience a wide range of emotions. If you or somebody you know was diagnosed with cancer, and being that my job is talking with folks to provide support, I hopefully obviously feel that talking can be incredibly helpful. And there are a lot of support options that are available. I think support from others who understand can also help your ability to just cope and feel more in control over your situation. I think it can also help foster a sense of hope. Like I said, there's a lot of different ways that you can have a space to talk about and process your emotions and your feelings and your experiences. You can join a group like Cancer Support Community. They offer a ton of groups. I'm a big advocate for Cancer Support Community. And I like that they offer things literally every day. They are a busy organization. They are offering things throughout the day and in person and virtual. So people have some ways that they can figure out what works best for them. And towards the end of the presentation, Erica, you can talk a little bit more about maybe some of the groups that are available. You can also receive one-on-one support with a trained mental health care professional like myself. There's also folks out in the community who specialize in providing mental health care during a cancer experience. Keep lines of communication open with your family and friends. There are online supports, online chat forums, Facebook pages. I think we just need to use them wisely. There's some really good ones out there, and there's some that are not so helpful. So I think it's important to make sure you kind of vet any online groups or forums to see if they are things that are providing legitimate information. Are they ran by people who are knowledgeable about the topics that they are talking about? But also know yourself. If you join a group or an online chat and you leave feeling more anxious or more down, that's probably not a helpful group for you to participate in. And it's okay to pause those things. And you can always try them again at some other point if you feel like that would be useful. So cancer treatment, medical visits, they take place over months or potentially even years. And even with top of the line insurance, people's financial landscape can really change drastically during this time. So I think the first step to managing the cost of treatment is asking for help. Working together with your care team to understand the cost and the payment options that are available, talking with other professionals like nurse navigators, social workers, and financial counselors, if they're available, can be useful. These are folks who are in your corner to help you figure out how do we get through this without depleting all of your resources. If the cost of things like caregiving is a concern, there may be resources available either through the state or other local agencies. It never hurts to ask. Even if we don't have the answer right away, usually we're very willing and happy to figure out if there is an answer and how we can connect you with the right people. All right, so many are uncertain about how to move forward after cancer treatment. And so feeling anxious about the future is understandable. It's very common. It's common for people to wonder or think about whether or not cancer will come back and what happens at that point. So if we can go to the next slide. So I'll talk a little bit about fear of recurrence and scanxiety. And then Dr. Shaw can also kind of chime in from, again, her standpoint on post-treatment concerns. But fear of recurrence and skin anxiety are common experiences after treatment is completed. But they're also a little bit different. They're not the exact same thing. So fear of recurrence is the fear that cancer might come back sometime in the future. It's going to recur, happen again. Skin anxiety is this increased feeling of anxiety, typically leading up to things like follow-up scans, follow-up appointments, while waiting for results or waiting to meet with your provider before getting blood work. So how do we cope with these two things? Because they really kind of represent a big ball of uncertainty and of unknown. So many times, people try to avoid thinking about their condition, their treatment, the risk of recurrence, whereas others might become a little more hypervigilant or sensitive and concerned with any issue regarding their health. And so coping with these factors really requires a team approach. Please let your healthcare providers know if these are concerns that you're experiencing. Know that it's common, it's normal, and there are ways that we can help make it manageable so it's not impacting your life so significantly. If you're having physical symptoms that are causing the anxiety, keep notes of those things. Track them. If there are things that are, happening, but they only last for an hour and then they never come back, that's a good thing to note, but probably not something that we have to overly focus on. Whereas if you're able to keep notes and we see this is happening for a while, that's a great time to talk with your medical team. Write your feelings down for reflection. And know that these things typically kind of come and go. They wax and they wane. And so figuring out how to kind of surf those moments can be useful. For some, things like spirituality or faith or religion may also be a great way to have some comfort and support during that time.
Yeah, no, I agree with Dr. Frost, what she said. I think it's very important to be aware of any symptoms or concerns that you may have. And, typically, usually after the initial treatment has completed, and when you're in this kind of routine of getting scans, it'll be maybe a scan and blood work and follow-up every 3 months. But if you start noticing symptoms, it's okay to reach out to your doctor and be like, I know I'm not seeing you till a month from now, but I have this concern and I would like to address it. I think that's very, very important. Go to the next. And so, after you complete that initial portion of the chemotherapy, surgery, radiation, your doctor may recommend for maintenance therapy. And now maintenance therapy is typically used to help slow down or stop your cancer's growth and help prevent it from coming back. A lot of times this is used to help reduce your risk of that cancer coming back. And for maintenance therapy, there could be chemotherapies or those targeted therapies that sometimes are used for like ovarian cancer, for example. And post-treatment, there are survivorship care plans. So this is a detailed plan given to a cancer survivor after treatment ends. That contains a summary of the treatment, also recommendations of follow-up. The plan is based on the type of cancer, the stage of cancer, what treatment you got. And that may be, in the first year, you may need scans every 3 months. And then after 2-3 years, it may space out to 6 months. This would be a plan of, what blood work would entail. And it's important to be following up with your provider care team. Because again, not only are we looking out for any new concerns or recurrence, but also knowing about those late-term or long-term side effects that may occur. Sometimes these side effects can linger for a little bit. So knowing how you're doing with that and making sure that you don't need to see another specialist or any other provider is also important. It's also important to continue to have a healthy lifestyle, continue to have a healthy diet, exercise, limiting alcohol, smoking use. And it always helps to have a copy of all your medical records, all your treatments that you went, so that you know what kind of has happened. And if you see a specialist, you have all that information there. And then the other important kind of, I would say, piece to cancer care is palliative care. Palliative care, I think of it as an umbrella where they focus on many different things. And the biggest thing is focusing on symptoms and improving the quality of life for patients who are undergoing treatment for any serious type of cancer. Now, a lot of times people confuse palliative care and hospice. Hospice is within palliative care, but it's not exactly the same thing. Palliative care team, they can help with hospice care, but they also can help with patients who are undergoing treatment to help with pain, nausea, vomiting. There are a group of other doctors or advanced practitioners who will help to make sure that patients are comfortable while they're undergoing these treatments.
Right. So caring for caregivers. So we know that cancer doesn't just affect the person that has the disease, but also their loved ones. It's really important for caregivers to make sure that they are taking care of their own health during this journey. So often I see caregivers, well-intentioned, focusing on the person with the diagnosis, but they start to neglect things like their own nutrition and their own physical exercise and sleep, and they're missing their own medical visits. So I really want to emphasize that taking on that role of caregiver is hard, and we need to make sure that you're taking care of yourself, right? We always hear you can't pour from an empty cup, right? Cars need gas in their tank to be able to go. And caregivers also need all of those things to help them provide the best care possible. So it's important that as a caregiver, find support. That could be through a formal support group. It could be through your own friends or family, people that you can talk to. It could be through healthy outlets like exercise or art, for example. And looking and asking for help can feel hard. A lot of times we don't like to say that we need help or support, but it will absolutely help alleviate some of the challenges that you might encounter when you're providing care. So we know that caregivers provide support in so many different ways. This puts the numbers to that, but I just, in the interest of time, I'm going to keep going. As I said, it's important for you to take care of yourself. These are ways that you can do that. Set limits, manage your stress, be direct with people. Tell them the kind of support and the help that you would find most beneficial. It might be saying, hey, if you could wash the dishes for me today, that would be great. Or, and this is me wishing we didn't have so much snow, but saying, hey, can you mow the lawn for me, right? When we can start to see the grass again. But I think being very clear with the tasks that other people can take off your plate can be a great way to take some of that off of yours and have other people join in and being able to provide the support to you and your loved one. Again, finding support through groups, individual counseling, or perhaps your own faith, religious communities can be a great way to connect with people. We also might have to care from a distance. So you might not be local to your loved one. So there are ways that you can still provide that caregiving from afar. I think one is understanding the situation, asking questions, getting clarification. Perhaps you participate in visits via phone or virtually in some way. You can create lists of things like important contacts for emergencies. You don't have to rush decisions. You can always take a breath, take a moment, kind of gather yourself and your resources before you're making decisions. And again, listening and seeking help when you need it is going to be just a really, really important skill to implement during this time.
All right. As Dr. Frost mentioned earlier, we have many great supports here at Cancer Support Community in Delaware. And I know many of you on this call are already engaged in a lot of these things I'm going to talk about, but we do have Living with Cancer weekly support groups. They're made up of people with all different cancers. They talk about the emotional journey of cancer. We also have caregiver groups, same thing every week, and they talk with each other about the challenges of being on this journey as well. We do offer a GYN monthly support group that is done virtually. Two other ones that aren't on here, but I thought of during our presentation, we have a spirituality, uncertainty, and cancer group that meets twice a month, which hits some of the topics we talked about today. And then we also have a stage 4, we call it the stage 4 couch for those diagnosed with they know their cancer is metastatic and they're interested in talking a little more deeply and openly about end of life things. So we kind of provide things all across the board there in the way of support groups. But then also we have healthy lifestyle classes to do some of those things you heard both of the doctors talk about today, the importance of movement and doing classes. It's socializing as well as exercising your body. And we provide them at all of our offices. I also am going to mention we are part of a national organization called Cancer Support Community. There's lots of resources listed here. You will get this slide deck and you'll be able to click on some of these. There's all sorts of things out there you can check out. A few of our national organizations resources, just to mention, are first of all, they have a helpline. We here in Delaware are not part of that. They run it separately from us, but you can call to ask specific questions. It's not a hotline that's 24/7, but it is, basic office hours. You can call and get some more information. Most of the time, they're going to refer you back to us for support for the things we do here, but they also are great with financial questions or maybe some kind of specialist or who they may recommend for a second opinion, things like that, questions that we might not necessarily have the answer on. So the number is there on your screen if you are interested in them. I believe you can find it on our website as well. Another resource our national office offers is something called My Lifeline. It's available in multiple languages. It is pretty much, to summarize it, it's like Facebook for cancer patients. It allows you to put information on there and share it with others, but it's a little more protected and private than Facebook. And then also our national organization provides something called a Cancer Experience Registry. This is basically like doing a survey. If you're interested, you can sign up. It takes about 35 to 40 minutes the first time you go on to fill out information about your cancer. This is for caregivers as well as patients. And we are able to use that then in getting grants. You saw the one slide today with the percentage of things that caregivers were concerned about. It came directly from our Cancer Experience Registry. So it's the one-time sign up, and then about every 6 months or so, they may contact you for kind of a continuing to add to your information as you're continuing to undergo treatment. So it's a way to just provide some data for those doing research in cancer and cancer care. And then we do have an advocacy piece of our national organization, and they're doing a lot, especially in Washington, making sure treatments are being paid for and research is happening. And so you can find information on that on our national website. And now we are up to the point where we'll open it up for questions. So I don't see anything in the chat yet, but if you want to put something in the chat, I can ask the question, or if you want to unmute yourself and ask, please go ahead. And we just ask that you keep it to general questions, not specific or personal questions about your case. All right, I thought that was a great presentation. So far, no questions. I don't even have any questions because I thought it was so wonderfully done. While we're waiting to see if there's any questions, Dr. Shaw or Dr. Frost, do you have anything you meant to say during the presentation but forgot to?
No, I think, and I'll speak for myself and let kind of Dr. Shaw chime in, but If there's questions that come up after we end the video today, you're certainly, Erica, I don't know if you're open to having them send them to you, and then you're always welcome to send them our way if that's helpful.
Absolutely, I will. We'll definitely do that.
Yes, I think that would definitely be fine.
So we do have a question. Is there a position called a clinical trial navigator?
Yes, so there is typically at least one or really like a group of nurses who are kind of overseeing clinical trials, and a lot of times they will screen our patients to see, okay, are they potentially, could they be eligible for a clinical trial? So they would be the ones who kind of can also give more information, answer questions specifically about the clinical trial, along with, of course, your physician, healthcare team. But there is usually a group who is looking at the current clinical trials that are available.
Great, good question. Okay, well, if there isn't any more questions, I'm going to go ahead and wrap us up. You will get a recording, the slide deck, any resources, my contact information in case you have further questions. I will do my best to get the answer for you. So I thank you all for being here, and thank you so much to Dr. Shaw and Dr. Frost and medical oncology hematology consultants for letting us borrow you for this afternoon.